So we'll now hear from the first two presenters on our first panel, which relates to health literacy in public libraries, etc. After their presentation, just as a matter of format, we'll take a short break and then reconvene to hear from the rest of the panel, addressing community-based health literacy programs and health literacy and health start programs. Marisa New and Leslie Gelders will be presenting together on building community-based health literacy interventions in Oklahoma. Ms. New is the chair of the Southwest Regional Health Equity Council and is also a board member of the Oklahoma Health Equity Campaign, two community-based partnerships with the goal of addressing health inequities in Oklahoma. Ms. Gelders is a literacy coordinator at the Oklahoma Department of Libraries Literacy Resource Office. This office works with library and community-based literacy programs, works with state agencies and other organizations to promote literacy throughout the state. So I will ask you to begin, and Marisa, I think you're first.
Okay, in Oklahoma, we're consistently been at the bottom of the national health rankings. To address this negative reality, we recognize the power of relationships and its profound influence in supporting policies, practices, and programs. Our grassroots coalition, called the Oklahoma Health Equity Campaign, launched our statewide efforts in 2008 and enhanced our focus on health literacy in 2011. We used video conferencing to connect with our rural communities so we could share expertise and experiences from multi-sector partners to better understand how community resources make an impact on health. In this slide, this is one of the tools that we use to describe the factors involved in addressing health equity from a public health perspective. And as you can see, it isn't an all-inclusive list in the different columns represented, but it's a tool that shows, again, the complexity in advancing health equity. But again, when we looked at these different areas that have influence, what you see here is not an all-inclusive list. We partnered along the way with a number of different organizations, and I want to recognize the National Association of Chronic Disease Directors, our Health Equity Council, who one of the members provided this particular tool that's been useful. As we moved forward, we pulled people together and began sharing what was going on in our different community sectors in relation to health. We realized early that words matter, and that this recognition triggered the need for and development of our different position statements. These statements highlighted how life-enhancing community resources or social determinants, such as food security and public transportation, impact health. In so doing, we had our non-traditional multi-sector partners share their expertise and experiences using lay terms rather than technical jargon as much as possible at our coalition meetings. These position statements were end products of the sharing and learning process. Our broad-based policy recommendations at the end of these documents serve as points to engage others in conversation. These statements define our coalition. As we communicate with others through our listserv, social media, and our presentations, we attach these statements to reinforce our position. In 2011, members of our steering committee recognized the value of having a representative from our libraries. As a result, we now have Leslie Gelders on our board. She, along with others, volunteer members, have served as content experts in the development of our position statements. And soon you're going to hear more from Leslie and the Oklahoma Department of Libraries as they've worked with their local communities. In 2012, Oklahoma had its first Health Literacy Summit. We modeled it after summits held in Wisconsin and Florida. Health literacy experts such as Andrew Pleasant and others were featured speakers. In 2014, we held our second summit called Health Literacy, a powerful tool for prevention and partnership, and decided to feature Dr. Andrew Pleasant because he did such a stellar job in 2012. After the half-day summit, we convened a dialogue session where we invited interested stakeholders. These were individuals who actively participated in past meetings and provided insightful comments not only in person but in writing. This dialogue exchange proved fruitful from a grassroots perspective and from a capacity building perspective, but we realized we needed more decision makers sitting around the table. In between summits, we have had many engagement activities that have attracted new partners and have kept existing partners coming back for more. Our listserv messages have proven to be the easiest and most effective, but in recent years, we've also begun using Facebook and Twitter. Meeting in front of groups, of course, is key in establishing relationships. In our early years, and even today on occasion, we utilize the PBS documentary series, Unnatural Causes, Is Inequality Making Us Sick? After each viewing of a segment in the community, we would engage the audience in some dialogue where we would ask them some key questions that, again, these were the same questions that we would ask over and over again. And over several years, we had conducted several community dialogues where the information helped to, again, drive the direction of the steering of the coalition. Finally, other organizations have invited our coalition to participate in their policy forums or contribute in some way. So in 2014, we had the Oklahoma Academy Town Hall Conference. This was a convening of public and private stakeholders, and every year there would be different topics that would be highlighted. In 2013, it was on transportation. In 2014 here, you see it was about health. What can we do better, improving the health of the Oklahoma people? In 2015, we were invited to another statewide coalition's policy day. And there we had a particular session that was focused on health literacy, and two policy recommendations that came out of that was, first one was advocating for state leaders to understand the link between health and literacy, and consequently reinstate funding for adult literacy programs. Two, request the state legislature to conduct an interim study examining the effects of low health literacy. In 2016, and I know this list is kind of small font, apologize, but there's a number of partners represented. In 2016, we had another opportunity to respond to partner feedback by providing training on evidence-based opportunities or interventions, such as Teach Back and Ask Me 3. In so doing, Dr. Pleasant was asked to return to Oklahoma to conduct this training. Again, Oklahoma responded with nearly 100 individuals engaged in the training, and the following day, as we did in 2014, we invited leaders from public and private organizations to attend a one-day action planning meeting. And we're pleased to say that the action plan meeting brought decision makers to the table, the directors of these agencies or the CEOs of these public private entities. The end result of our efforts was the creation of the Oklahoma Health Literacy Action Plan with these two broad-based goals that we were going to be following. And immediately thereafter, we realized that Health Literacy Month was only a couple of months away. In order to capture an easy win following this meeting, we quickly met with public information officers and communication directors from that group that were interested in and sharing some messages, health literacy messages, through Twitter, Facebook, and our listserv. And one of our partners, which was the U.S. Department of Health and Human Services, the Region 6 office, they had suggested us using Thunderclap, which we never heard about, as a social media amplifier. So we quickly integrated that into our process too, and through all these social media interventions, we reached about 175 individuals that month, October 2016. And Thunderclap in itself reached over 116,000 people on October 3rd, 2016. So we're, again, going to be doing that this October for Health Literacy Month. But unfortunately, engagement of our coalition has been limited this past year, but despite budget pressures putting a squeeze on the availability of public resources, our steering committee has decided to forge ahead as a nonprofit organization, calling ourselves the Oklahoma Health Equity Network. And we're going to continue with the inertia and momentum that was created by the Oklahoma Health Equity Campaign. The momentum in Oklahoma is extending past our state lines, with several of our steering committee members serving on the Southwest Regional Health Equity Council. And this council involves our states of Arkansas, Texas, Oklahoma, New Mexico, and Louisiana, where we have a grassroots representation. In 2015, the Southwest Regional Health Equity Council developed a blueprint, and our call to action was to launch a regional campaign, again emphasizing in enhancing individual and community well-being, and our strategy was to focus on a couple of evidence-based interventions, which I mentioned earlier, the Teach Back method and ASME 3. And if you see here at the bottom, what we always are knowing that the leveraging of who is involved in the process and the organizations they represent, we're trying to align as much as possible with those different entities, again, to utilize the depth of which entities have done the research to support efforts. So again, to help influence and expedite interventions that make a difference on our community's health.